And then the layperson is like, I didn't know I could get help for that. I didn't know. I thought I had to live with it. And I have to keep saying, no, these conditions are common. They're not normal.
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the Active Mom Podcast. Our next guest she's kind of been an OG in pelvic floor physiotherapy for a very, very long time, much longer than me. I've known her for a long time via Duke Physical Therapy and Pelvic Health. They've got a great reputation. And we got to connect recently at the AUGS PFT conference in Vancouver in fall 2025. And then I think it was like a week later at the Menopause Society conference in Orlando. And we got to chatting and thought it would be great to have her come on the podcast. So Ingrid Harm-Ernandes, welcome to the show.
Oh, thank you for having me. Really excited about many different things we can talk about for sure.
Yeah, we got to see each other like once a week for a couple of weeks there. I feel like we've been missing each other now.
Right. Isn't that funny that happens? You know, life always throws little curves here and there, and you never know what's coming up next.
No. All right. Well, tell everybody if you're not a physio or you're not familiar with Ingrid, why don't you tell everybody kind of a little bit about you and what you've been up to since your quote retirement, not really retirement.
Right. A lesson in retirement as well there, I guess, right? So I am a pelvic PT. I was an ortho PT first because when I went through school over 40 years ago, there was no such thing as pelvic PT. So I've been a pelvic PT for a little over 30 years. It's kind of when it started to come around in the country, and it was brand new. And the doctors that I talked to thought I was totally nuts when I told them that I could help their patients with incontinence and pelvic pain and constipation. And it took a little convincing back then to get people to send that first patient. So I always draw people's attention to that gap that we have between being a PT and pelvic PT and the growth during that time, which I think has been tremendous, but just not enough. And I feel like I'm always stepping on this big pedestal. I'm sure you feel the same as, hey, this is what we do. This is how we can
screaming it. Yeah.
So I feel like that's still a big thing. But, you know, when you mention retirement, the reason why I laugh about it is because I stopped working clinically, but my focus has completely become educational. And so I educate the lay person, I educate the medical individual, I educate anybody around. I mean, just yesterday, I was talking to someone who was supposed to be setting me up with an interview that I was going to be doing. And then I said, well, do you know what I really do? And she's heavy in the medical field, and she's not herself, but she has talked with doctors and nurses and in the menopause world, right? So then I explained to her, and she goes, man, I thought I knew what you do and how important you guys are, but I had no idea. And I said, that's what everybody says. They all say I had no idea. So I feel like we still have such a job to do, so much work to do on it. I'm loving the improvements, but we still have work to do.
Yeah, I think that was one of the hallway conversations we had in Vancouver was because you've worked with AUGS, which is the Urogynecology Association, for a long time and provided education, based on pelvic floor physio. But we still keep having these introductory conversations of people who have not heard of us and what we do. For you, how do you continue to have the tolerance, the stamina, the motivation to continue to, stand on that pedestal with your megaphone and keep screaming the same thing over and over again?
Oh, sometimes it's frustrating, but mostly I try to say to myself, okay, so there are millions of people out there who need the help. And then there are hundreds and hundreds and hundreds of thousands of medical practitioners who maybe have a little exposure and they think they know, but I always say you don't know what you don't know. And I try to keep that in the back of my mind, because then every time I have the conversation, the medical practitioner is like, oh, now I know where I can send someone. And to me, that's so valuable. And then the layperson is like, I didn't know I could get help for that.
I
I
know.
didn't know. I thought I had to live with it. And I have to keep saying, no, these conditions are common. They're not
Yeah.
normal. We need to normalize the conversation about it,
Yeah.
right? But they're not normal, so that people say, oh, that means I can ask for help. I don't have to live for it and live with it. And that's why I really try to always, step back a minute and say, don't get frustrated. Just realize the exposure to people isn't as good as you think it is.
Right.
And that your job is to honestly get people comfortable with this, talking about it, asking about it, and then getting help or giving help, whichever end they are on that spectrum. Right. So
Yeah.
I think that helps me just to say, okay, I know and I feel immersed in this, but the majority of people still don't.
Yeah. No, I think that's such a great reminder for those of us, like our algorithm is like cutting edge, this is what we know about pregnancy exercise and, all this other stuff, that we have to remember that there's still people that are coming into the pipeline, that it's brand spanking new. And we have to, oh gosh, there's a quote and I use it all the time and it's going to kill me because I don't remember who it is. It's basically, you need to go back. If people are falling into the river, you need to go back and figure out why or where they're falling in. And we have to remember, like, they're coming in here from somewhere. We need to catch them when they come in.
Yes,
Which
absolutely.
I think it's like Desmond Tutu or something like that. I really should remember it. But um, I think, one of the newer areas that it's not new, is menopause and perimenopause. But in our education as physios, I don't ever remember it being uttered in PT school. I think even in, our board certification exam, maybe there was like a paragraph. And I remember just skipping over it because I'm like, well, what can I do anyway? And that's become kind of a real passion project for you, more recently. So tell us a little bit about kind of how that came to be. And then, you've kind of seen this rise in popularity of talking about menopause, and God forbid we call perimenopause what it is too. Like, talk us a little bit through kind of your journey through that space.
Yeah, so it was 0% big goose egg on learning anything about menopause. Menopause kind of was something that happened to maybe some of your patients when they were older for a year or two. And, you know, so what? You can't
Right.
do anything about it. And really the connotation, even from me growing up, and especially like the people before me, was, yeah, just live with it. Laugh about it if you can, but live with it. Live with the
Right.
hot flushes, which is what everybody talks about now,
Yeah,
which drives
it
me
does.
crazy.
Right.
Or if you have incontinence, live with it. You're getting older. So what? Put a pad on, right? So that was the attitude. And that attitude is really hard to fight through. So I would say on my own with my patients is when I started to notice that some of these things were happening earlier
Mhm.
than that 50, 51, 52, and no
Mhm.
one was making any connections. And I was like, yeah, there's got to be more to this. If I'm seeing this regularly, it can't just be because you're a woman. It can't just be because you're 50. You know what I'm saying? So I
Yeah.
started making connections myself and started saying, so let me look at the patient as a whole, which is really what I did early on, I think, because of my ortho lens.
Yeah.
So being an ortho PT, let me look at everything and say, I'm not just treating a pelvis, I'm
Yeah.
treating a body. And if I'm treating a body, I'm treating everything else that's happening to this body.
Yeah.
And if I can help guide them through some of the difficult times and make them feel like you're not making this up, you're not imagining it, and you shouldn't be poo pooed because of it,
Mhm.
then let's have a conversation and see if we can help you through some of those things. So I think I was doing that long before anybody was talking about menopause.
Mhm.
So when people started talking about it, I'm like, okay, then.
Like, welcome to the group chat.
I was on the right track, but I didn't necessarily know how to call everything the
Right.
right thing or help people 100%.
Yeah.
And I think, fortunately and unfortunately, social media has made people want to ask more or learn more. And there's
Yeah.
lots of good stuff and there's lots of really bad stuff out there.
Yeah.
And now I feel the role is to help people weed through all of that and try to come up with a solution that's good for them as an individual, right?
Yeah.
And that's what I argue with people all the time is we can't just say, okay, well, you're in menopause, you're in perimenopause, and we can break that up too, but that means you have this, and this, and we treat it this, and this way. I'm like, no, you are someone who just had a baby and you're having fourth trimester into perimenopause symptoms.
Right.
Well, we might need to treat you differently than the 55-year-old who walks in the office or the
Right.
35-year-old who's in medical perimenopause. You know what I'm saying? So
Yeah.
I feel like really for me, talking to people about individualized care with a bigger knowledge behind that these things happen, but you're a person, you're an individual, and I'm going to treat you because you're having these symptoms now.
Right.
Does that make sense?
Yeah, yeah. No, I mean, and I told you, and I've been pretty open about. I kind of went headfirst into perimenopause about 2 years ago, and I realized I was not addressing, validating, acknowledging anything, and by just being aware, because even though we can't prescribe, even though I can't put you on HRT or I can't write your prescription for topical vaginal estrogen or this and that, I feel like we're back to being what we do best as pelvic floor physios is like we do a good job laying things out, almost being like the social worker of a scenario, being like, okay, yes, you may be 40 and you're having these symptoms. You had some fertility issues. We need to consider, potentially primary and ovarian insufficiency, just like being aware of these things because people are being dismissed. Oh, you're too young for this.
Mhm.
And so to be able to find providers that will acknowledge them, listen to them, but then also help women not gaslight themselves because all they're used to is the jokes about vasomotor symptoms. They have all these other things going on, like joint pain or all of a sudden change in continence or something like that. And they don't put that stuff together that no, you're definitely in perimenopause. But again, I think that goes back to what we've always done best as pelvic floor physios, which is take a really complicated situation and start to clarify and bring in other team members to the whole thing.
Right.
How have you seen that kind of like I feel like we're diving into this at like Mach speed at this point. How do you kind of see that transition going and what could we do better and what are we doing okay with?
Yeah. Oh, wow. So loaded questions. But I think what I'll do is I'll go back a little bit to,
Yeah.
I got very excited in 2024 when the paper, The Musculoskeletal Syndrome of Menopause was
Right.
released.
Yep.
And to me, that was like, oh, this is fantastic. This is really going to describe so much of what I've seen in clinic, like put
Mhm.
a name to it so it's a little easier for people to grasp it. But when I read the paper, I was so disappointed because there was about one or two sentences on genitourinary syndrome of menopause.
Mhm.
So this is the pelvic floor component of it. So it still told me that, okay, we're talking about this broader spectrum of symptoms that people can have, but
Right.
we're still not addressing that the pelvic floor is an integral part of that.
Yeah.
Yeah. So, and that goes to my point of saying we need the team of
Mhm.
practitioners to treat someone. It doesn't
Yep.
mean that you always need 10 different practitioners, but it means, especially as things get more complex, that having 2, 3, 4, 5, practitioners may be what you need to resolve everything, right? To really pull things together and help someone, feel like, oh, I'm being heard, I'm
Right.
being treated, I'm everything's being addressed, and one person might not be able to address all those things, right?
Exactly.
So that kind of goes back to the team approach. So
Yep.
my wish and my hope and my change is, I think as physical therapists, we're doing a great job looking at this bigger picture, like you just said.
Right.
But I hope for our sake and for all other practitioners, they start to see the value of that interdisciplinary team.
Yeah.
That's where we need to be better, all of us. And I tell my patients, you're the center of that wheel, and you may need to ask for physical therapy. You may need to ask for an OBGYN. You might need to ask for a sex therapist. You might need to ask for
Right.
acupuncture or that therapist. For me, I felt like I became the center and I was the one that referred out instead of referrals coming into me. That's how my practice started to progress over time, is that people got to know know me well enough that I actually became the center of
Mhm.
saying, let's go do this. Let's address this. Look at this. Do
Right.
we need a dermatologist? And people are like, what do you
Right.
mean I'm like, oh yeah, that's part of pelvic health too, right?
Yeah.
That's
Yeah.
my hope is that we grow and really encourage, which you mentioned OGs. So I
Mhm.
think they're a great society that really encourages that interdisciplinary care. To kind of answer that part of your question is they really always, or even early on when I started with them, really pulled in the PA, the NP, the PT, and really try to get that as part of it. Even though they are primarily surgeons, they see the value of
Right.
all these other practitioners pulling together to treat the patient as a whole. And I
Mhm.
think as surgeon, that's pretty phenomenal because you don't see other surgical practices necessarily
That's
reaching
true.
out to other
Yeah.
practices, right?
Yeah, no, I feel it too. I mean, I feel like both of us have been really lucky that we worked with some really amazing urogynecologists over the years. I started out my career working with Cheryl Glacia, which is kind of like she's the OG. Everybody knows Cheryl. Um, and just helping spread that advocacy role for, the importance of having us as a part of the team. I'm actually really curious, and this kind of brings 2 points, of conversation we were just talking about together, but I'm gonna take a hard right for a second. I would love to have more conversations with urogyns about our patients that are between that postpartum and perimenopause age period that are active and may have had significant birth trauma, birth injuries. They're going in for surgical intervention, and a lot of our data says you shouldn't be lifting, da, 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 and it's all based on occupational health data. I think we need to get more of them involved in crossover with what we're kind of learning about exercise and pregnancy and what we know about exercise and perimenopause, how important it is. How can we make sure that we've got good, viable surgeries, that we're protecting them as long as possible, but we're taking into consideration that we have women that are more active than ever and want to continue to stay that way and have the option for surgical intervention. So yeah, I just took a hard right there, but like, what are your thoughts on that one? Because it kind of mashes up a lot of the things that we were just talking about.
Yeah, I would love to see more of that because I think once you get more practitioners in there discussing these topics, there's more
Yeah,
weight to the
yeah,
topic, right? And there's more buy in to,
yeah,
oh, okay, so it's not just you saying this, it is a group of people from different disciplines all coming together and saying, and that's like interdisciplinary care. We need interdisciplinary research,
yeah,
right? Really think about that is to why not and that
right,
now you're pulling in all the facets of care and you're so right about the data just saying oh well you have to be careful, you can't do this, you can't do that, and a lot of it is the fear of long ago of oh you're going to hurt the baby or you're going
mhm,
to hurt yourself or whatever.
yeah,
But I think like
specifically or whatever. Yeah,
what were women doing 1,000 years ago? They were carrying heavy loads of wood for their
yeah,
fireplace. Like, come
yeah,
on, right? It became this like protective mechanism, and I can see where it came from, but it
hmm,
became a block and a barrier. Like that protective mechanism ends up being a barrier, and that's the other
yeah,
thing that we really need to realize is we've got to reduce those barriers because as someone goes through perimenopause and menopause, it is the time where they need to be doing
yeah,
exercise, right?
yeah,
Because everything that's coming out now is how exercise, resistance training, plyometrics,
yeah,
all of this weight training is protective against hot flashes,
yeah,
bone loss, muscle mass loss, which is huge. The sarcopenia that they used to say, oh, well, that's just an older person in their 80s. But no, sarcopenia, this muscle mass loss, starts with perimenopause, which can be as early mid 30s.
yeah,
But for most, it's somewhere in their 40s where they're starting
right,
this process, right? So now's the time where you're taking care of your kids, you're having a pregnancy, you're taking care of parents that are aging.
yes,
You're in this process where it's like, oh, I'm just going to let that all go to the side. And it's the time where no, we need to make the time. Like we need to
right,
show the importance of it. And I think if we can change research to show,
yeah,
which it is showing now, but we need more that
right,
says it's okay to exercise. If you've got medical issues and you've got high risk factors, yeah, let's talk to the
Mhm.
medical practitioner. Let's make sure you're doing the right thing. But
Right.
if you're the average everyday person going through pregnancy, fourth trimester and beyond, the
Mhm.
exercise is perfect. It's the exact thing that they need.
Right. Well, you bring up such a great point, and I feel like the narrative, there's so many parallels, I think, between like the perimenopause, menopause conversation and then the pregnancy postpartum conversation, not only just the hormone situation, but I mean, in pregnancy postpartum exercise, the research has been just like gangbusters the last couple of years. Thank you to our Canadian colleagues, by the way, because they're killing it. And so, but a lot of that has really made us go back and look and say, our guidance to people over the years has been protective when we actually didn't have data to say that we needed protection. And so it's now shifting to, okay, yes, be aware of medical issues, but at the same time, let's not gatekeep. And I see the same thing happening in perimenopause and menopause. Do this, don't do that. And it's number one, it's maddening as somebody going through that time period myself, that you don't know what to do. And that's not only exercise, but nutrition and, what kind of weights and how much weights and that sort of thing. And like, it doesn't have to be, but the people saying it don't really have any data to fall back on. And a lot of it's like based on data that's postmenopausal and you're trying to apply it to perimenopausal. And like it makes me angry. So you've gone through the change, you've done all that, you've kind of dealt with this for a long time. For you, how does this feel in the rear view looking back on your own
Mm.
experience, being like, okay, well, you think you're going crazy. We didn't have anything.
Oh, I talk about frustration. So there's a double-edged frustration there. Is one is I'm so annoyed. I am a very physically active person and I stayed active and I kind of like I didn't do what people were told to do back then because I felt like and this comes from my mom and I am so grateful for my parents because they were so advanced for their age
Mhm.
range. So my parents I was born very late in my parents' life. So in particular, their age was such that they lived through two world wars. They lived through terrible situations. They were more like, we're going to do what nature says. We're going to work through this. We've seen hardship. We know what we can do,
Right.
and we are going to do what we feel our bodies are telling us to do. So when my mom came over to this country and she had the three of us, my two older sisters, myself, she wanted a natural childbirth. They were so nasty with her. So, no, you don't do that.
Where
You
did she
don't
come from?
breastfeed. You don't, oh, it was horrible. And she just said, well, you know what? I was meant to breastfeed and I'm going to breastfeed. They didn't
Yeah.
even want to bring us to her in the hospital because they were so annoyed that she wanted to breastfeed,
Where was
right?
she from?
From Germany. But in Germany, they did that. So in Germany,
Yeah.
she grew up with this is what
Yeah.
we do. And she was told, no, in the United States, we don't do that.
Oh, good Lord.
We induce labor, we do this, we knock you out. And
Oh,
they left her alone in the delivery room because she didn't want to be knocked out while she labored. Yeah. You talk about bad care. So I grew up with I am going to do what nature says. I'm going to be
yeah.
smart and read on things and I had to go to the library. I'm going to date myself to read things. I didn't have the
Hey,
internet.
I went too.
but it was interesting. So I am thankful for my parents to give me
Yeah.
the wherewithal to say I'm going to do what I feel is good for my body within reason.
Mhm.
Right. So I think I grew up pushing through things that I knew would be good for me, that I
Mhm.
knew that nature intended to do
Yeah.
without having the information to back me up.
Yeah.
And then I started to see information coming out. But I know people all my age have screamed about this and wanted help for it. We
Mhm.
were ignored. Like
Right.
beyond gaslighting, it's like you just go away. It's
Yeah.
like, so for
Yeah.
me, that frustration turned into I'm not going to let that happen to another generation. But the
Mhm.
other end of the frustration is to hear a younger set say, we're not going to be like the older set or baby boomers,
Yes.
because they didn't even ask for this. I'm like, no, we were screaming for it, but we were 100% ignored. So my point on that is always be grateful for the
Know
people
your
who come
history.
before you. You're standing on their shoulders. They had a harder time getting heard than you do. Be grateful for that. And now make that even more, like push that even
Yeah.
further. So my thought process to everybody out there is please be grateful for who's before you and help those after you. Be that
Yeah.
important person in between to bridge, what's been happening, right? Sorry,
I'm
now I got on my soapbox.
No, but I'm so glad you said that. And this whole year, I feel like the theme of this year has been to like look at the parallels in history because we have and forgive me for hopping on my soapbox. Um, you know, women didn't have options. And a lot of that was societal and where you lived and what was acceptable. And and that's just even if we go as basic as women running and participating in marathons. And now it's okay for a pregnant woman to show up in a gym and work out and all of these things. And then now we get to perimenopause and menopause, and I have all these Gen Z, I think. No, it's Gen Z after. I always get this mixed up. So I'm Gen X. Millennials come after,
Oh,
and then Gen
yes.
Z.
And then Gen Z. Yeah.
Okay, so all the millennials were like, well, we're going to fix perimenopause. And I'm like, hold up a second. First of all, you ain't there yet. And if you are, that's a very few of you. And we'll pass it back. I'm like, don't jump ahead. But again, like my mom is late 70s, and it wasn't until the last couple of years that she explained the crap that she went through being taken off of HRT. And I didn't live at home at the time, and so I didn't realize what a shit show it was. And I'm like, you had it and then you lost it, and that's really not fair. And then so all of these things, to your point, know your history. You are not the first one just because it's like when you realize you're pregnant, then all of a sudden all you see is pregnant people. Like, remember that there were pregnant people before you. You
Mhm.
are not the first. But yes, we can pass the torch and we can move along, but please say thank you.
Yes, 100%. It's a shame. I think it kind of stops us from realizing the wealth of information from the generation. Like you said, you talked with your mom, right? And
Yeah.
you helped her realize, oh, it's okay to talk about this. It's good to talk
Yeah.
about this, and maybe I can help someone else. So I
Yeah.
always say, look at each generation on each side, and know that you're that person that hopefully can tie things
Yeah.
together and help people, and not poo-poo what's before and what's after.
Right.
So it's a hard thing. I think this is beyond just pelvic PT. It's really, a philosophy for life,
Yeah.
to think about that and just know that in pelvic PT, we see so much of this because pelvic issues are still so ignored. We had these discussions about perimenopause and menopause, post-menopause, but we still are not talking that much about pelvic floor conditions. So I feel like
Right.
when I talk to people about menopause, I'm going to be, this is so far beyond the hot flashes. Like that's just the tip of the
Yeah.
iceberg or the volcano, whichever way you want to look at
Right.
it.
No,
And
that's
it's
the
so much
intro.
more.
Yeah, no, for
Yeah.
sure. And again, I think hopefully, I do see more pelvic floor PTs talking about um, perimenopause and menopause, but to your point, I don't know that I see as many of them engage in the pelvic floor piece of it. Where I think we can be huge advocates is really that, and this is where I think women my vintage, where our kids are like middle school, high school, that sort of thing, where maybe you heard about pelvic floor PT, but you didn't have access to it, or it wasn't like a thing that your doctor referred to because they thought it was a fad. Don't tell me how many times I've heard that.
Mm.
Um,
Mm.
yeah, like, I did. I literally, after having an exam, this was years ago. After I had an exam, and I was like, oh yeah, I know I do orthopedic PT and I do pelvic floor PT. She's like, oh, what are you going to do when that fad wears off? And I was like, I'm sorry, what? Still here.
Wow.
And I heard somebody else tell me that the other day. I was like, oh God, anyway. No, but the point I was trying to make is there's a gap for those of us that maybe we didn't get that early postpartum care, or we were told not to do anything till 6 weeks or 12 weeks if we had C-sections. And so some of those issues that are very clearly residual from postpartum are coming back up as we're trying to be more active in postpartum, or as we're starting to kind of run into these, dives and hormones and things like that. Like, I feel like there's a whole subset of us that we almost have to go back and do postpartum boot camp and get caught up. And I have to explain to them, you didn't do anything wrong. we just didn't know then what we know now. And you didn't miss it. They're like, oh, I didn't go to pelvic floor PT. I'm like, that's fine. I probably would have done you something completely different than I did today. How much of that, like, do you see kind of playing into this as well, is to go back and kind of educate into some of the things that we've learned in postpartum?
Right, right. This is why I call this entire phase of pregnancy to postpartum the continuum of life,
Yeah.
because I want people to realize that what happens during pregnancy and postpartum, the symptoms that we get, the conditions that arise, are very, very similar to perimenopause and
Yes.
menopause. They are so much similar that a lot of these symptoms that do occur and they may temporarily go away can come back, just like you were
Mhm.
saying, right? So I think when we're talking to our pregnant and our fourth trimester patients, we need to talk to them about, hey, these symptoms occur now. So it's really important to address them, not to sound like a downer. It's not like, oh, this is definitely going to come back. But if we address this during pregnancy and
Mhm.
fourth trimester, we're going to reduce the risk of
Yeah.
it coming back later in life. And if it does come back later in life, we're like, oh, I know what that is and I know what it can do
Yeah.
for it.
Yeah.
Right. So it becomes a very positive thing to address it right away.
Yeah.
And then the other thing we have to realize is our people are getting pregnant later in life. So their fourth trimester is in their 40s
Yep.
when a lot of women start to have perimenopause symptoms.
Yep.
So that menopause transition can be, I think, what is the average? It's between something like 5 and 7, no, 7 and 10 years now, they're actually saying, right? That's a long time period. So if you're
Yeah.
42, you can expect you're probably going to get some introductory symptoms,
Mhm.
right? Now, some people have no symptoms whatsoever, and some have horrible symptoms. There's a broad spectrum of what can occur. But I think if we're helping people understand that these things can happen early,
Mhm.
then we're going to be preventative of things that happen later, including the muscle mass loss and the bone density
Yeah.
loss, which to a lot of people are kind of quote unquote invisible. They're
Mhm.
not as visible as incontinence or prolapse. And even those things are hidden, right?
Mhm.
Imagine now we have no idea until it's too late
Right.
that there's an osteoporosis change, there's a muscle mass change, which
Yeah.
is why I was saying before, it's so important to tell our women let's stop the cardio, that's the only thing to do. There's value, don't get me wrong, there's value to cardio, but there's as much value, if not more, to doing weight training, resistance,
Yeah.
plyometrics, because all the data is now showing that plyometrics can not only halt bone density loss, it can improve the
Yeah.
actual bone density, right? So
Yeah.
there's now great information out there showing that it can actually help, and that exercise can help vasomotor symptoms. We're
Yeah.
getting that information to back up what we've known for years. And now we can say, look, we've got the proof for it.
And that's honestly, I think, a great place for us as pelvic floor PTs to slide in, because if you have somebody that maybe they were just doing walking for exercise or things like that, and they think, okay, I want to do plyometrics, and the first time they do any sort of jump, all of a sudden they leak. Now that becomes a barrier to doing the things that you think you want to do, or they want to do quote heavy lifting, don't know what that means, and then maybe they have leakage of urine or something during that. And I think, again, this is where I like to have these conversations way early. So, if early as possible, I want to introduce the idea of resistance and impact training for our pregnant moms, for our postpartum moms, so that it's not new when you get to perimenopause. And then we've already had that conversation about how the pelvic floor functions. Because again, I think everybody's still stuck in this idea of the pelvic floor, like that being that hammock, that's the thing that controls your organs and your leakage and stuff. We know so much more about the three dimensionality. And really, it's the external urethral sphincter. And actually, all these muscles are anticipatory. And it's far more than just strength. It's actually coordination. And we need to introduce impact in order to train it and whatnot.
A
But
100%.
but I'm just like, the sooner we start that conversation, but again, like this is another one of those where we have to kind of get everybody caught up. But it really can be a barrier when people are trying to do the right thing. Be like, okay, yeah, I'm going to do plyometrics. I signed up for a class and that, or a course or something like that. And the first jump, maybe the third, you're leaking. You're like, well, shit, I don't want to do that. That's not
Right.
fun.
Right,
I'm not going to
right.
keep going through that. So that's where I think it's a huge opportunity for us to be able to go in and educate and say, this is not because of age. This is not like we can trace this back. Maybe there's a hormone component to it, local topical vaginal estrogen. Um, but this is where we can help and we can get you so you can do those things.
Yeah. I think this is the place for us to be the rock stars because we're the ones that are going to say, well, you are having these issues. Let's
Yeah.
talk about how can we change what you're doing so that you can do what you want to do. I always had said to my patients for years, it's not about you can't do this. It's how do we do it differently so you can do it.
Right.
And that's like the phrase I used to use with my patients all the time. And I think some aha moments for me were way back when I said, well, if my patient's leaking, I'm going to take it reverse. They come in because they're leaking, not because they want to get stronger, let's say, right? Because
Right.
this is years ago. And they finally admitted they were leaking and they needed help. And for me, it was, okay, so when do you leak? And we'd go through the process. And if the
Yeah.
leaking was, let's say, well, I like to jump rope.
Mhm.
That would just be an example, right? I'd say, okay, so let's make sure you know how to use your pelvic floor. You're doing it properly. Then the next step for me was, let's see what happens when you jump rope. Okay, so let's practice maybe without the jump rope, doing tiny hops and then
Yeah.
trying to coordinate your pelvic floor with the hops, right? Then I had an aha moment like, well, why aren't we just doing this with everything? So I used to
Yeah.
do it with people who, played. I had a guy playing trumpet, and helped him with
Yeah.
that. I had someone who golfed to lead. I had someone who coached a soccer team. And every time he yelled across the field, he would have a leak, right? So this
Mhm.
is everybody across the board. And my thought process then was, oh, well, let me make this very functional.
Yeah.
And let me teach them how to use their pelvic floor at the right time. So when
Yeah.
we play a sport, we go to how do we train the body to do that sport well? How do we strengthen? How do we coordinate? How do we do speed? How do we, whatever it happens to be? It doesn't matter for the sport, but you know what I'm saying? We
Yeah.
we do it to the sport. Well, I'm like, well, your life is like your sport, right? And I
Mhm.
would tell people, you may not be able to, when I had them like on a cough or a sneeze, said, you might not be able to coordinate your pelvic floor with the cough or sneeze the first couple of times you do it. But just like a sport, the more you practice, the better you get at it. So
Yeah.
let's coordinate using the pelvic floor properly with the activity. And that's
Yeah.
weightlifting,
Well,
right?
and that's the thing that, like, at the time, and this is, I'm showing my age too, is I remember thinking like that was so revolutionary. Well, why don't we integrate? And now, since then, we've had so much research to say, okay, actually, when you run before your foot hits the ground, we've got pelvic floor activity that's like so freaking fast that our cognitive contractions can't possibly match up. So we do have to integrate the exercises, maybe not necessarily with a cognitive contraction, but again, the fact that that was, hey, let's think about the pelvic floor in the context of a functional activity was so groundbreaking. And it sounds ridiculous now, but we're like, oh, we really had to come along a long, long way.
Well,
But that's
yeah,
also from the time when you and I both had, clinic treatment rooms and you were in a room with a table and that was it. Meanwhile, now I have my whole gym and, with Allie that we run and all this stuff, but it just goes to show how far things have come in research, but we still we're still trying to understand what the pelvic floor actually does when we run and lift and things like that. So
yeah, yeah. When I
it is
first
cool.
introduced doing like pelvic health, um, in the clinics that I was in, I was never in a women's health clinic.
Yeah.
Especially when I started, we were so rare. We were like tucked in wherever.
Yeah.
And they were like, well, what do you just need your room and your table. I'm like, no, I really would like to have like resistance bands and maybe a treadmill. And they're like, why do you need that? I'm like, why wouldn't I? My patients
Right.
are people like everybody else. So it was kind of funny that I was asking for these things long before it was even thought. Like people had trouble enough with pelvic PT, but to
Right.
think like we treat the whole body.
Right.
It's a person walking in it isn't their pelvis. They're an entire
Yeah.
human being.
Well, again, there's so many of us again, and it's so cool to hear now that came up in orthopedics land and sports land and that sort of thing, and then sort of landed in pelvic health, and then we mashed it all up together independently of knowing each other. So I feel like there's kind of like a sorority of us where we're like all over the world. We kind of figured this out, and then realized, wow, that wasn't that unique. We all figured it out. I don't know. Great minds. I'll take it. I'll take it.
Oh
All right. So
my.
for you, um, I kind of mentioned this before we hopped on. Thinking back on the conferences that we went to, where do you think there's more of an opportunity to leverage? Because I think we both would agree. Yes, it's neither were pelvic PT conferences, but both of them were interdisciplinary. Where are there opportunities? Where's the best opportunity to leverage a pelvic floor physio voice? Um, and what could that look like?
Yeah, so even American Urogynecological Society, OGS really is very good with it, but I do feel like you still need to stay on top. You still need to make sure your voice is heard, that
Mhm,
you integrate things on a regular basis, that they kind of know you're there, they know what
mhm,
you do, because it's very easy in everybody's busy life to stay down in your own little lane, your own silo, and kind of start leaving things off to the side, right? So if
mhm.
you aren't the constant voice, that can happen. Um, it was for me, it's a funny word to use, but it's not meant in a bad way. And I think I was saying it to you at one of the conferences. It's like infiltrating another society.
Yes.
It's not a, I don't mean it in a
Yeah,
bad
but
way.
you need to understand the culture and I think that's a really important thing. You can't go in gangbusters. You have to go in, you have to listen, you have to understand who the players are. I mean, imagine
Yes.
how you would feel if somebody came in and, tried to blow up your game and didn't know anything about you. I get it,
Right,
totally.
right.
Yeah.
I think some of the biggest things we can do is make sure that we are talking that we're a partner in the
Yeah.
patient's care. We're not coming in to take over something, right?
Mhm.
Because that immediately gets people's hackles up, and they're like, nah, not really, right? So it's a little harder, I think. So with the Menopause Society, I did try to reach out. I did talk to them. I feel like I think both of us had the same feeling, like although there was mention of pelvic PT, it wasn't like, hey guys, this is what can happen and this is what we can do and this is why it's important, right? So I think sometimes finding another practitioner that's maybe more well versed in that society,
Mhm.
to talk to them,
Yep.
get the information across to them where they're like, oh,
Yeah.
now I know what you're talking about. And now I see the value, right?
Yeah.
That's how I started with OGS, actually, to tell
Mhm.
you the truth is I knew the surgeons really well who were in a lot of the different components of
Yeah.
OGS. And we talked for quite a while, and they're like, you need to belong to OGS. Like they actually said it to
Yeah.
me
Mhm.
a long time ago. And
Yeah.
I've been very active since. And it's so rewarding to see the changes, the fellows and the newbies into the
Yeah.
field, and even those who've been around. When I do this lab that I do for OGS APP, so Advanced Practice Provider Conference, I have models, pelvic PT models, and we teach them a very rudimentary pelvic floor exam. So it's
Mhm.
nothing like we do as PTs, but it lets them discover, wow, there is an obturator internus.
Yeah.
Wow, there is a coccygeus, and it lets them find it and then
Yeah.
do an appropriate referral to pelvic
Yeah.
PT. Do you know every year, last year I had a NP come to me and say, I have been practicing in this field for 24 years and I had no idea I could do this. She's in the
I
field.
believe it. Yeah,
Mhm.
no, and that's the thing. I mean, we get into our holes, and there's some of us that like to play in other sandboxes. But I'm just thinking, we had they had some PT sessions or some physio sessions for us at OGS, and they could have each been like 2 3 day conferences. It was like one was pessary use, one was real time ultrasound, one was talking about pelvic pain. I would love if you even just took one of those topics and had it with everybody just to see this is what we do in this space. This is where the evidence is in this space. This is where we're forward thinkers in this space. I would love to bring us out of the corner. And yeah, it's great for us to, and it was lovely to hang out with the Canadian physios. They're amazing. But I would love to have the opportunity to do that. And same thing with Menopause Society. Like, I think they maybe said it once during the vulvar conversation. I'm like, that's kind of our jam with vulvar
Right,
pain. And then bone
right.
health, I think there was oh my gosh, somebody mentions, oh, you can't exercise that. I'm like, wait, you can. I'm like, wait.
Uh-huh.
So I mean, I'm trying to look at, and it seems like you are too, trying to look at it in a positive way of like, hey, here's a lot of opportunity for us. We just need to go about it in a very intentional way, and put our egos aside and figure out the best way to get this information forward, because that's one of those going in the river points is with our a lot of our referring physicians is if they know us and they have experience with us and know what we can do and know how we can help their most challenging patients, then it's wide open. It's wide
Hmm.
open. But
Right, right.
I think that's anybody who has ever worked with us in the history of our profession is whatever you can't figure out. That's kind of where we jump in and we figure it out.
And that's what, think about it. Yeah, I've had patients refer to me. They're like, well, they didn't know what to do with me, so they sent
Yeah,
me to you. I'm like,
yeah,
okay.
it's fine. It's fine. Yeah, no, no, and again, I'm cool with that. That's fine. And some of it is we have the opportunity to be able to listen, but we have this ability to look at multi systems. We have this. A lot of us have this background in musculoskeletal and orthopedics, and that's where it's been such a joy for me to be able to mash up all these things with
Yeah.
running and sport and activity. And I'm like, okay, all my favorite things in one spot.
Yeah, yeah. It's great when you do see all that come together, and you've known how important that is, and
Yeah.
and now you can see not only from what you've done in clinic, like you have the
Yeah.
proof of what you're doing in clinic, but now we have research to
Yeah.
kind of back those things up, and that's a beautiful thing that we just need to get more people to know that.
Yes. No, and that's where I'm hugely grateful for. There's so many more women going into research in a lot of these areas, and we're literally drinking from the fire hose in pregnancy and postpartum exercise research right now. It's fantastic, um, and I'm hoping that it's going to do the same thing. When we get to perimenopause and menopause, and the interest there, and there's a lot of, and it primarily women researchers, which I really appreciate too. So, no, I think we have a lot of good stuff coming, and it's just a really fun time to be in this space. As we kind of wrap up at the end of every episode, I have a couple questions for you. So, what is a book you're reading or a podcast that you're listening to right now?
Oh my. um, so Feisty Menopause does some very interesting talk about sports and menopause and all that.
Yeah. Yep.
He's got some
Yes.
great
On the
podcasts.
podcast. Yep.
Yeah, yeah. So I've been listening to a number of hers lately and
Yeah.
really kind of enjoy the broad spectrum of how she
Mhm.
approaches things. So that's been fun. Um, and so I just finished reading The Menopause Brain. I've looked over at it right now. And I am probably going to start reading a book more on bone health,
Okay.
just getting a little more information. I feel like there's always so much more out there to learn. So I'm trying to do that. So I can't say I'm reading any
Okay.
fun books as far as like novels or anything, but certainly just books to keep pushing some of this, like get a better understanding for myself so I can explain things to people better. I
Yeah.
feel like sometimes those books does do that for you. They're like, oh, now I know how to put that in better words,
Right. No, bone health, that's an interesting one. I'm really like, and I introduced you to one of my former colleagues at Georgetown, and Dr. Andrea Singer, and she's quite involved in bone health as well. And I think she was saying, I don't remember the society, it's Society for Bone Health or something. I don't know, it was a conference up here in DC in the spring. So maybe I'll dip my toe in that and kind of see what's going on. Maybe we can go conferencing again together.
Yes, that would be great. I'd love it.
All right. I'm going to adapt this next question. Usually it's favorite activity since becoming a mom. What I'm going to adapt it for is what's your favorite activity since becoming semi-retired?
Oh my gosh. A million and one things. So the great thing about retirement is I think some of the things that you didn't have time for, you can now
Mm.
really like you can delve into. So I've always been a gardener. So my vegetable and flower gardens have spread, and that has let me. So behind me
Yeah.
is a pelvis with a sunflower in it. And that is my artwork. So I have gone back to artwork and I've combined, you talk about combining things, my love for artwork, for my garden, and for my pelvic health. So I get to put three things together in one. And I had an art show, my first art show last year. And it's just been a blast to be able to do that kind of stuff and kind of marry all my loves together. And the other thing is the educational component of what I do is spending a lot more time doing, whether it's a podcast or a book club. Like I literally have ladies have a club or a women's club or a
Yeah.
library, whatever. And I just go in and I talk all about my book. I talk about
Yes,
what
grab the
pelvic
book.
will help.
Let's show it real
Oh,
quick. Grab it. Okay, what's the name of it? Tell us
So let
about
me
it.
see. The Musculoskeletal Mystery: How to Solve Your Pelvic Floor Symptoms. So it's a combined book. I wrote it during the pandemic of everything from what is the musculoskeletal system. So people really understand that we're not just talking about a pelvic floor, but we're talking about the whole core. So it
Yeah.
goes through how that's all related and why the different muscles do different things.
Mhm.
And then it's a bit about like who are all the practitioners you might need to reach out to if you have these symptoms. So everything from acupuncture, sex therapist, mental health, OBGYN, urogynecologist, you name it,
Yeah.
it's in there. And then what we do in an assessment as a pelvic PT and what we do in treatment. And the reason why I wrote those chapters, I kind of thought through it a little bit, is I'm sure you've had this happen. I've had patients say, I was referred to you a year ago, 5 years ago,
Yeah.
and I never went because I was afraid. I didn't know what you guys do.
Yeah.
No one explained it to me. And I thought, wow.
Mhm.
And talk about OGS. They did a paper on less than 50% of the patients who are referred to pelvic
Actually
PT
go.
actually
Yeah.
go. And that's in the Urogyne world. What is that in the family med world?
Mhm.
10%? I don't
Right.
know. So I thought, gosh, if people can at least read it about it and not be so fearful about what it means to go to pelvic PT, they'll
Mhm.
go, they'll get the help, right?
Yeah.
They'll stick with it. So it's
Yeah.
all about that as well. And it's just like some life things woven into what I call pearls of wisdom, just from doing it for so long and things
Mhm.
I explain to patients and kind of some things that happen to some of my patients that maybe people reading it can relate to.
Yeah.
So it's a little bit of a storytelling within the book itself. And I just feel like when people read it, so I've been at a couple of times at different farms, and you're like, a farm book signing? I'm like, sure, people are into health. Why not? Right.
Right.
And so I might see them a couple months later and they're like, oh, I'm so thankful I got your book. Thank you so much for writing that. I
Yeah.
started doing some of the things you talked about, and I went to a pelvic PT, and it really changed my life. So I'm like,
Yeah.
wow, okay, that was the purpose of the book, is change people's lives.
Yeah.
Whether you are a lay person, you have a loved one going through this, or you're a practitioner. It's written that practitioners can read this. I have
Yeah.
practitioners read it and they're like, I really, really didn't know what you guys did. Now I
Mhm.
can explain it to my patients. Now it
Yeah.
helped me. I didn't know that I could get help for those kinds of problems.
Yeah.
And they're in the medical field, right?
Yeah.
So that was my goal with the book, is to really stop that I don't know what I can do. I didn't know I could help myself, to
Yeah.
wow, I can do so many different things for myself. I can help myself, or I can help my loved one or my neighbor
Yeah.
who was like very embarrassed about something that happened while we were together. And now this legitimizes the conversation. You take this book, which is,
Yeah.
it's lightweight. It's got, oh, by the way, I was thinking of perimenopause and menopause. Oh, John.
Thank you for those of us who have readers.
So I had all that in mind when I developed the book,
Yeah.
and I'm just so grateful that I have the opportunity to help people live through a part of their life that is difficult to talk about, and to
Mhm.
get them talking about them and get the help that they need. So that's been very rewarding, and that's taken up my quote unquote retirement.
That's not retirement. No, but I love that after, being in our field for so long, that you have such a passion to still, go back to the beginning and be like, look, we're here, we're here, we're here. And I can see how, like, it might be like, gosh, am I still doing this? But like, it seems like you haven't lost that excitement about introducing somebody to it, whether it's a patient or a provider, but doing it in a way that's accessible for them. I mean, I know, some generations are very, social media oriented, and I feel like our field's done a decent job kind of introducing in that way, but not everybody, that's not their cup of tea. So I appreciate that you're like, nope, we're going to do it a little bit different. We're doing farm book signings. We'll talk about pelvic floors and cows. I don't know.
Yeah, yeah. For me, I look back at, if ever I get discouraged and I say like,
Yeah.
I can't do this anymore. And everybody does that, but I think back to all those patients who came in
Yeah.
who were desperate for help. They were what people consider the last stop. And I
Mm.
hated the fact that people thought I was the last stop, right?
Yeah.
And I just think they struggled so much
Mhm.
and their lives were so affected.
Mhm.
And that by going through something like pelvic PT, which, my brain is, "Oh, that's so simple. It's so straightforward." It's not. It's not
It's
to
not.
the vast majority of
Yeah.
people. And I have to keep thinking back, those are the people that need me to say this. They
Mhm.
need me to get the
Yeah.
message out so either they can reach out or their practitioner can. So
Yeah.
every time I get discouraged, I'm like, nope, remember those people who you were able to change what happened in their life. You were able to give them their quality of life back. And this is my way of giving back.
Yeah.
It's all the rewards that it sounds funny, the rewards I had by having patients saying you changed my life
Yeah.
that I need to give back. I feel it's my responsibility to give back, to be on podcasts like yours, to have people listen, to
Yeah.
say, "Oh, I hadn't thought about it that way," or "I
Right.
didn't know that I could do that," or "I didn't know I could think about something that way."
Mhm.
If we even capture one or two people, you're
Yep.
changing their life that way, right?
Yeah.
And that keeps me going, is to make sure that we are constantly helping people in
I
that
love
capacity.
that. I love that. Retirement goals. All right, last one here. Who's someone in your space that we should know about? And you get extra points if it's somebody that I don't know.
Wow.
Who's somebody you're fangirling over, or you're just really reading a lot of their work, or you're impressed with them, or you cross paths with them? Who should be paying attention
Uh,
to right now?
so if we talk about social media, because I'm not a fan,
It's okay. I love
but
hate relationship. It's all
there,
good.
there are people on social media that are doing an awesome job, like you, right?
Thank you.
But Jocelyn Wittstein is
Yes, she is on my list.
yeah, so she's an orthopedist, but
Mhm.
she is just amazing on taking really good information and translating it into something that everybody can understand,
Mhm.
that really is relevant to everything we just talked about.
Yep.
And she is actually an author on the musculoskeletal syndrome of menopause.
Mhm.
She's at Duke. So I reached out to her. I'm like, hey, can we
Yeah.
talk just a little bit? We had a we had a walking conversation, a walking meeting, which is what I do lately, is
Yeah.
walking meetings, not sitting
Mhm.
meetings. And I really helped her see our point of view.
Mhm.
And she was thrilled. She was excited about like everything that as pelvic PTs we do and why looking at the pelvic floor as part of this whole unit of the musculoskeletal syndrome
Yeah.
of menopause needs to be addressed. And we
Yep.
talked about some ways that research can address it better and what might happen down the road as a result and that kind of thing. So I felt like, so I got to meet her personally, which was awesome.
Yeah.
And I see the work she's doing, which is
Yep.
awesome. And I think that like that's the kind of person that we need more of, right? We
Yeah.
need more out there. The other person that's no longer in my space, I already mentioned, is my mother, because she lived to almost 99.
Oh my goodness.
Like I said, she had me at a very late point in life, and she was, I can only say, I could hope I can be the 10th of the woman that my mother was, because she fought against things that were commonplace then. And she knew in her heart of hearts that it wasn't the way to go. And she
Mhm.
fought through it in a very quiet, very classy, very determined way. And I just hope I can do the same thing. So, like I said, she's not in my space, but it's someone people should know about.
I think she would be proud of you. I mean, again, like you are one of the OG pinnacles in our field, and I'm so lucky that I've known you for as long as I have, and we get to crash into each other every once in a while. So.
Hopefully, more often, right?
More often, yes, we will do that. All right, if you guys want to know a little bit more about Ingrid, you can find her on Instagram occasionally, Hernandez, and then you can grab her book, I think on Amazon. Yes, you can grab it?
It's on Amazon. Just
Okay.
please, people, be careful. So you can get it Amazon or Desert Harvest.
Okay.
.com. Amazon, be very careful. There is something that people do is they purchase your book and then they sell it for twice the amount?
Oh, just reach out to Ingrid and she'll figure out a way for you to get the book.
Yeah.
So we'll just do that
You just have
instead.
to like go below and there's like a other methods of buy, right? And it's $24.95. So
Okay.
please don't pay $50 for it.
So
That's
just
crazy.
we'll scratch that. We'll just say go talk to Ingrid. She'll help you figure out how to get your book. So.
Or go on Desert Harvest, desertharvest.com. Has it. Yeah.
Sounds
Yeah.
good. All right. So thank you so much for joining us, and thank you for everything that you've done for our profession and what you continue to do in your quote retirement.
Thank you for having me, and thank you for everything you do. I enjoy, like I said, I'm not big social media. I enjoy your posts. I think they're awesome.
Thank you. Take care.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.